So this is a PDF file. Emmett will tell you I'm not very good with technology, but I'm very good with exercise. So bear with me here. So this is lupus and exercise, how to get started. Janet mentioned that some of you might have trouble feeling motivated to get started. Some of us might even feel fearful to exercise because we have a lot of pain, a lot of chronic pain, right? Or some of us might feel like, where do we start? Do we do cardio? Do we do strength training? Is it going to hurt? What do I do if I'm already in pain? There's a lot of questions around exercising, but yet our doctor says you should exercise, right? We've all been told you should exercise more. Our doctor says exercise is good, but all of those ins and outs that are very nuanced, and especially when it comes to having an autoimmune disease, how do you exercise with an autoimmune disease? How do you exercise with lupus in a way that doesn't make you even more tired, right? Doesn't cause more pain, doesn't cause exercise-induced flare-ups. What do you do if you're exercising or you're dealing with exercise intolerance, right? So those are all things that we're going to be talking about today. So a lot to cover. Like I said, I can get pretty nerdy with this topic. So I will try to kind of go through this presentation quickly so we have a lot of time for Q&A at the end. So just a little bit about me. I was diagnosed with lupus in 2008, so 13 years ago. I was in high school, I was 16 at the time. So try navigating lupus and finding a prom date. That was me in high school, right? In college, I majored in exercise and sports science. I was an athlete growing up. I did gymnastics, played soccer in high school. So I was really interested in the exercise and sports science field. I went into college thinking I wanted to do physical therapy, but in college, I realized I really enjoyed more of the preventative side of things. And so I became a group exercise instructor, and then I became a personal trainer. And then in 2006, I became a business owner. I opened up my own health coaching business, where I have since worked with a variety of clients spanning across all multiple autoimmune diseases. That's where I specialize in working with individuals that have autoimmune disease and helping them implement exercise into their lifestyle. And so I love helping women love their body again, women and men love their body again, with simple movements, breath work, simple nutrition. If you were here at the beginning, Emmett mentioned that, the exercises that I teach in my monthly autoimmune movement class, they are not complicated, but a very good workout, right? And that's what I want to emphasize today, that exercise doesn't have to look like what you think it might need to look like in order for you to do it. Exercise and movement is a very, very vast and broad topic, and you can make it your own in a way that works for you. Other things about me, I'm a plant mom. I don't know if you can see my plants behind me, they're kind of off to the side, but also dog mom. I have a 4-year-old boxer that's full of energy. I also really enjoy writing on my blog and traveling when we are able to. And don't let the health coach title fool you. I really love M&Ms. So if anyone wants to send me any, I will accept. All right. What we're going to talk about today, what is exercise? What are the benefits of exercise? Some evidence-based exercise. So I'll share some studies with you that have been done with lupus patients and exercise. What to consider and then how to get started. So moving into what is exercise. So these are different terms that we often kind of use interchangeably, like physical activity and exercise. So physical activity is literally any bodily movement. So you want to think of physical activity as this umbrella term, right? And then exercise is a subcategory of physical activity. So exercise is very planned, very structured physical activity that is purposeful and repetitive. So you have all heard the term activities of daily living. So the purpose of exercise is to make our activities of daily living a lot easier. So we exercise so that our life outside of the gym or your workout is a lot easier, is a lot more functional, is a lot more independent. right? So we all think about our life long term and wanting to have that freedom to be able to move around and function as an individual on our own, right? That independence. And so we exercise to make activities of daily living easier. And so you want to ask you want to ask yourself, what do I do for each of these categories, right? So first think about, what do you do in your day-to-day life? Like, do you have stairs you frequently go up and down, right? Are you someone that picks up a lot of things off the floor? Like, for example, someone that maybe works at a packaging plant, for example, they load and unload a lot of boxes. So for that individual, that is part of their activities of daily living. That is their job, right? And so their exercise, which is planned and structured, intentional, would incorporate a lot of rotational activities, a lot of hinging and picking things up off the floor. So that's just one example. You want to think about, what do you do often? Do you live alone? Do you have to reach overhead often? And if that's the case, in your exercise plan, you would incorporate a lot of upper body mobility, stability, and strengthening for your upper body, right? So ask yourself, what do I do for each of these categories? What do I do in my day-to-day life? What are those frequent activities that I do day to day? And how can my exercise reflect those specific activities to make my life easier, right? I know that exercise is really more thought of to lose weight, to feel better, to look good. We often, more often than not, hear that conversation in the doctor's office, like, oh, you need to lose weight and you'll feel better. I like to change that conversation a little bit. That for me, exercise is not really about the losing weight, the looking good, the feeling good. It's to maintain functionality, right? And so sometimes exercise really is just about the perspective that you take with it, and making exercise fit your lifestyle. So for me, is about maintaining functionality, keeping inflammation down, teaching my immune system to respond efficiently to stress. And we'll talk a little bit more about that. But okay, so throughout this presentation, I know, we all know that receiving a diagnosis is very hard to receive. It's very confusing. So throughout this presentation, I just want to invite you to see your diagnosis as a springboard to better health, right? Because more often than not, I find autoimmune patients that receive their diagnosis and then that's it. That's like, well, this is my life now. And we think that our diagnosis is the cause of our symptoms, when really our diagnosis is simply a label for the way that our symptoms are showing up in our body. But really, those symptoms are your body's request for help. The saying kind of like, there's something wrong, so I'm manifesting in painful joints, or something wrong, so I'm manifesting in hair loss, or something wrong, so I'm manifesting in a skin rash, right? So I want you to start to see that diagnosis as a messenger, right? And use it as a springboard to say, okay, body, I'm going to listen to you. So throughout this presentation, I invite you to take a different perspective today on that diagnosis. So let's talk about the benefits of exercise. So a lot of these are very, very much physical benefits. It fights fatigue, stabilizes joints, eases inflammation, and can boost your mood with all those feel-good endorphins and hormones. But something that we don't often talk about when it comes to exercise is the relationship between exercise and your cognitive health, and the relationship between exercise and your lymphatic system. So when it comes to cognitive health, your frontal lobe, so kind of that front part of your brain right here, is very responsible for your personality, the decisions you make, your memories. Exercise highly impacts this frontal lobe. And while you might not see the benefits right away, right? Although you do experience that boost in like feeling good, but you want to think of exercise as kind of like deposits into a 401k, right? So now we have our 401k. It's this account that we make tiny deposits in for the long term, right? For a long-term investment. And that is what you are doing with exercise, is a long-term investment into your cognitive health for the long term. So while you might not really see like, does exercise really help me be functional to put on my clothes? Maybe you don't see that right away because you're still very capable of it. But when you're 70, 80 years old, you're going to be really thankful for all those small deposits you made into your cognitive bank account, so to speak. So exercise is kind of like that 401k investment. And now when it comes to your lymphatic system, so your lymphatic system is sort of that behind the scenes, behind the curtain person that like doesn't get any credit at the play, like, the like backstage people that are making sure the show is running, but they don't come out for curtain call, like no one sees them. And so your lymphatic system is kind of like that backstage crew, right? Your lymphatic system is also what you can think of as your body's waste removal. So any cells that die, any bacteria, toxins, whatever it might be that your immune system took care of, like it's gotta go somewhere, right? Your body needs to get rid of it in some shape or fashion. And so your lymphatic system, very important part of the immune system, is responsible for that waste removal in the body. Now, what is different about the lymphatic system is that it doesn't work on its own. So think about your lymphatic system very much like your circulatory system. It runs right along your circulatory system, right along those veins and arteries all through your body. But the circulatory system has a heart, it has a pump, and it pumps blood through your body. Your lymphatic system solely relies on two things: movement and breathing, to move lymph through the body. Okay, so your lymphatic fluid is what moves around. So it relies on that movement and that breath. So your body is dependent on you moving and breathing in order to get rid of waste, inflammation, toxins, anything in your body that shouldn't be there. Your lymphatic system is responsible for. Sometimes that lymphatic system needs a little bit of like manual help, which I'll be showing you all today, of how to stimulate the lymphatic system to move well in the body. So these are a couple of benefits that we don't often talk about with exercise, that cognitive and lymphatic system, but both very important, especially for those of us with autoimmune disease. We often get a lot of lymphatic blockage up here in the head. And so all those mornings that you wake up with brain fog, with a headache or a migraine, or you feel groggy, you all know what I'm talking about. We're like, lupus flare day, right? More often than not, there's likely a blockage of the lymphatic system. So I'm going to show you all how to make sure you keep your lymphatic system moving well.